With frontline workers still in short supply of personal protective equipment, many local heroes are rising to the challenge and stepping up to help supplement those life-saving supplies. And joining us now is an incredible nurse who has been working tirelessly to make homemade filtrated masks. University Health System's Chief Nurse Executive, Tommye Austin. Thank you so much for being with us, Tommye, and thank you for all that you do. You've been a nurse for more than 30 years. So tell me why you started making your own masks and who they were first intended for.
So on March the 17th, the Centers for Disease Control put out a statement that healthcare professionals could wear handkerchiefs and scarves. And so we became very alarmed by that. So initially, the masks were made for any healthcare provider in the facility should we run out of N95s.
All right, and then how did you just start making these masks?
Well, as you can see, I have a sewing machine. I'm a quilter, and I took a copy of a mask home and looked at it because some of the concerns that staff had told me was that they had hypercapnia, which is carbon dioxide buildup, and they had low oxygenation. And so based on those two things, I started to design a mask using interfacing. And I cut a pattern out that night and started designing a mask.
That is amazing, and I love that you've named your masks TM 2020, and they have special embroidery. Tell us about the personal meaning behind them.
So my name is Tommye, and I'm named after my father, and my father passed away last year, and so to honor him, I named the mask the Tommye mask.
I love that. How many masks have you made so far?
So far for the organization, we've made about 5,000 masks. And personally, I've probably sewn about 300 masks.
Wow. And do you have a goal? How many more masks you want to make, try to make?
Yes, we want to have at least 6,500 masks. So should we have a surge and should we run out of N95s? And my personal goal is to sew 1,000 masks.
Wow, I love that. And for people at home, because they can pitch in too, tell us how they can make their own version of your TM 2020 masks.
So I use a quilting cotton, which is a tightly woven cotton, and I use a face mask material that is specifically made, for face mask, and it is called Filti, F-I-L-T-I. And I take 2 layers of Filti and put it in between the 2 layers of cotton, and I sew it up, and I use a what they call a coffee tie for the nose bridge. And I use elastic to hold the mask in place.
Tell me, what have your coworkers said in response to getting all of these beautiful and effective masks?
Well, some of the feedback that I've gotten from individuals, it varies. So, for example, I had a colleague in Austin who's a dentist who could not find masks to open her practice. So I sent her some masks and she was able to start her practice again. Other staff have told me that they're able to breathe in the mask. I had an individual who's a singer. She's able to sing in the mask. I've just gotten very good feedback from the mask.
Well, I'm glad to hear that because you certainly deserve that and so much more. Nurse Tommye Austin, thank you so much for all you're doing, and thank you for giving us your time today to share it with us.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.